So the Challenge Fund is an initiative led out of the Cardiff Capital Region, and the university's partnering with our colleagues there to develop support for public sector organisations that have got problems that they can't solve with off-the-shelf solutions. So we work with them to identify the nature of the challenge and then put out a call to innovators who might have ideas.
We needed to change the way that we were delivering tracheostomy education because we couldn't do it in that classroom style. We couldn't get hold of those mannequins. We couldn't have people in the same physical space to allow us to do that. And through those chats with other clinicians, one of my colleagues mentioned the CCR challenge as a potential option, a way we could work with industry to develop something.
It's the first challenge that we've actually supported through the Cardiff Capital Region Challenge Fund. And the support that we've provided has been obviously the financial support, which is part of it, but as well as that, we've given support in terms of the design and the framing of the challenge and actually supporting the delivery of the challenge through the process. So it's been very much a partnership of Cardiff Capital Region working with partners in Cardiff University, with the Cardiff and Vale Health Board, Welsh Government and the Spree Centre of Excellence. It's been truly a collaborative project, multi-partner approach to this.
We are currently working with Rescape VR and Nudge Reality. And what they have designed for us and built in collaboration with clinicians is a simulation-based program for tracheostomy education, particularly focusing on tracheostomy emergencies, and also as a proof of concept how we could use VR for learning how to complete bronchoscopies and also intercostal train insertion.
The benefits of working through this type of process is it is competitive. So you have multiple businesses working in competition with each other, and that drives them to develop the best solution. And then the other important part is you get the intense collaboration between the private sector and the public sector working together to develop those new solutions in partnership.
We came across the Tracheostomy Challenge on Twitter, and it looked like a really good fit with the sort of technologies we've been developing, which include virtual reality for stroke rehabilitation. So we had a look at it, it was a really good fit, and we thought we also have a good partnership with Chester University, and we applied jointly with them and were successful.
We were very lucky because we were working alongside Swansea University. What then was absolutely amazing was our ability to work with the clinicians within the health boards to really ensure that the training and the content that we were putting together was ultra realistic.
What this VR program really allows you to do is be far more immersive in the world that we're working in, rather than doing a simulation in quite a sterile environment with a mannequin. You add that element of a patient as an avatar, but looks much more like a patient than a mannequin does.
I'm now going to check his inner tube, which I'm able to do in the VR world, and then we can see that it is dirty. I'm able to put that over there and replace it with a clean one.
And the bit that we're really excited about is the multi-user elements that allows you to do, so that we can bring clinicians from different backgrounds, from different hospitals, from different health boards, whatever it be, into that one scenario, so that they can all practice their learning and fully embrace that experience, so that when there is a tracheostomy emergency at 2 o'clock in the morning in the District General Hospital in West Wales, that everyone has received that kind of same standardised training.
It was definitely a very immersive experience, felt very realistic at times, and seeing the reactions of the patients.
The key benefits for staff are that it's an opportunity to practice unexpected and unplanned event in a safe way. The benefit for patients is that you can read through an algorithm, you can try and take it in, but the only time you may get to practice that is actually within an emergency situation.
Just the opportunity to do it again and reflect on it and talk through it and practice and re-practice. What this will do is it'll take away the trainer experience, and it'll always be consistent, so you know that everyone's had the same training.
Public sector organisations should get involved in challenge-led activity for a number of reasons. Firstly, it gives them a safe space to work with the private sector, and it gives them an opportunity to co-develop the solutions to their unique problems. It also provides a route to collaborate with wider bodies such as academic institutions and the third sector, and it can allow them to enter into agreements on a short-term basis to test new ideas and new thinking, but not commit them to a long-term procurement contract if things don't work.
I definitely recommend other companies get involved in this kind of challenge and this innovation project. For us, it's taken us from having an idea and a concept through to having a full product at the end of it, which has been developed and validated with the clinical team, which is exactly what we want.
It puts a good quality budget into a project, and it brings together the stakeholders that are facing the challenge and potential innovative companies like ourselves who can solve that challenge.
For innovators, we might be able to create that initial step into a new product area, new service area, give them the opportunity to pilot and market test with the public sector potential customer. For the city region, the initiative is intended to try and create new commercial opportunities, but also to work with the public sector on addressing societal challenges, particularly around health and well-being, the environment, and transforming communities in the post-pandemic context.